Hello, everyone, and welcome to the 5th Annual Shkreli Awards. I'm Vikas Sani, President of the Lown Institute. We're happy to have you all here with us today.
And I'm Shannon Brownlee. I'm Special Advisor to the President of the Lown Institute. So for those of you who are joining us for the first time, here's a little background on the awards. The Shkreli Awards, named, of course, for the infamous pharma bro, Martin Shkreli, are awarded each year to the 10 worst examples of profiteering and dysfunction in healthcare. We find our nominees by combing through hundreds of healthcare stories and from tips from readers of our newsletter, The Lown Weekly. And then with the help of our esteemed panel of judges, we pick the most deserving offenders.
So you might ask, why do we do this? We see these kinds of stories come through our newsfeed all the time, and it's really easy to become numb to them. But seeing them all together, these examples, really allows us to take them in and see beyond the individual bad actors or bad apples and really see the flaws in the system as a whole. And that's really why we do this. At the Lown Institute, we believe that we really could have a radically better healthcare system, that it's possible. So the Shkreli Awards are definitely a fun event for us, but it's also a chance for us to pause and reflect for a moment and think about the changes we need. And by seeing all of this shocking material in one place, we hope you too will see and be motivated and demand better change, more change in our system.
So what stands out about this year's Shkreli winners? We hear a lot about innovation from the healthcare sector, usually referring to new treatments or technologies that are supposed to make us healthier. And many of the winners of this year's awards are very innovative, but not in the ways we want them to be. They've found new and clever ways to exploit patients for profit. So as we go through the countdown, you'll see more about what we mean.
And we're very excited to have some special guests to help us count down the winners this year. Many of you may recognize our first guest, Dr. Will Flanary, or his alter ego, Dr. Glaucomflecken. His hilarious videos have made him one of the most popular doctors online, with nearly 500,000 followers on Twitter and 1 million on TikTok. Offline, Dr. Flanary is an ophthalmologist in Portland, Oregon. Will, we saw you recently in a video with the Surgeon General, Vivek Murthy. How did that happen? How did that come about?
Well, first of all, good job saying my name, Glaucomflecken. You nailed it. You went slow. That's the key. You gotta take it one syllable at a time. That was good. Yeah. So I thought it was a joke at first. I thought it was like a spam email, but I saw it was a .gov email from the Surgeon General's team, and they wanted to do something on burnout, and I'm not going to turn that down. They did, when they asked me to do something like that, I'm going to do it. And so I sent them a potential script, and they got back to me and wanted me to redo all of it. And so it was a back and forth for a while, and eventually we got it done.
Oh boy, that sounds great. So our other guest panelist is Dr. Gregg Gonsalves. He's a global health activist and epidemiologist and associate professor at Yale. He's also a MacArthur Fellowship recipient. Can you put in a good word for us? And he's worked on HIV and AIDS and other global health issues for more than 40 years. Greg, you're an expert on epidemiology, a field that really didn't get much attention and a lot of people probably couldn't pronounce 2 years ago. What's it like to have your field go from your relative obscurity to being in the spotlight?
Well, we only show up when there's disasters on the horizon, in my case, infectious disease disasters. So HIV, Ebola, H1N1, epidemiologists make, occasional appearance in the public eye. But when we do our best, nothing happens, right? And that's our job, is to keep things from happening. We're prevention science by and large. And so I'd rather have no pandemic and go back to relative obscurity than dealing with what we've been dealing with for the past 2+ years.
Oh boy, from your mouth to God's ear.
Yeah, well, thank you both for joining us. Let's get cracking. It's countdown time. So we're going to move through these quickly. We won't be able to take questions, but the chat is open. So if you'd like to comment, and we encourage you to, we'll capture it there. Or you can also indefinitely join the conversation on Twitter with the hashtag Shkreli Awards, if you can spell that. So let's go. Our first award goes to a story right out of the Martin Shkreli playbook. Number 10, suppository users experience discomfort of a 5,000% price increase. In 2008, a box of 30 Indocin suppositories, a treatment for arthritis, sold for less than $200. Then the company changed hands several times. And as Axios reported, so did the price. By October 2021, it was more than $10,000. That's $350 per suppository. So, Will, what do you think of that one?
I think it's a great way to kick this off. Like you said, Martin Shkreli would be proud, right? Like this, it's not quite on the level that he's at. I mean, this is the Shkreli Awards. This isn't the Indocin Suppository Awards, although that you could consider that for another year. You know, price gouging insulin, that's like on the Mount Rushmore. But this, like everything about this is painful. It's the price gouging, inserting $350 into your rectum once a day. It's just to give you a perspective, that's a Nintendo Switch every day.
God.
That's 147 Doritos Locos Tacos from Taco Bell every day into your rectum. And what's really the worst part though is that this keeps happening. And you think that the you know, regulations, you know, legislation, whatever, would have learned from the first time this happened, but there's no accountability, there's no transparency. So how it seems like there's no rules, right? What are we gonna do?
Yeah.
It's perfectly legal.
Yeah.
It's capitalism.
Yeah.
Yeah.
So, Greg, you want to pile on here?
You know, it would be sad if this was the only case that we've seen of this, but you know, your avatar for these awards is pioneered this kind of predatory behavior from pharmaceutical companies and their investors. So you know, this is one example among many that we could probably point out that are happening in the healthcare space right now.
Yep. Well, let's go to number 9. So pharma companies that use charitable giving to increase sales of their overpriced drugs. So pharma companies Biogen and Teva found a sneaky way to get Medicare to pay for their $80,000 a year multiple sclerosis drugs. Drug companies are barred from paying Medicare patients' copays, but Fierce Healthcare and Becker's Hospital Review reported that these two companies found a way around that rule. The companies donated to charities, and then they made sure the charities paid Medicare patients' copays, which amounted to thousands of dollars per patient. So now the insurer Humana is suing the drug companies for violating, get this, the RICO Act, the law that was created to combat organized crime. Greg, you got any thoughts?
Well, you know, charities is a nice charitable word to talk about these organizations that basically run interference with the drug companies and help to inflate medical costs across our society. And so again, while Biogen and Teva are noticeable examples, there are companies like Gilead and others in my space, the HIV space, who do this all the time. Mm-hmm. And it's a way we sock it to the consumer not once but twice in the purchase and use of these drugs.
Yeah, absolutely. I mean, you pay the taxes that pay for the research, and then we get to pay again when we buy the drugs, and then you get to pay again out of pocket.
Yeah. Will, any comments?
And it's just all of this, and what was a theme we're going to see throughout this is it just goes over the consumer's head. Like the consumer doesn't know about a lot of this thing, the background, what's, you know, the malfeasance going on behind the scenes to lead to all this nonsense. So it's kind of very frustrating.
Well, I got to jump in and add that the whole theory of the case of co-pays and deductibles is all about, putting patients at the front and somehow expecting that patients, when they face the financial pressure, are going to behave like Homo economicus, in the fantasy of what a healthcare marketplace could look like. First of all, healthcare ain't that way. That's a long conversation. But in this instance, what this shows really is that premise really breaks immediately, because what you have here are these one huge sector, the pharma sector, gaming it out against another sector. And patients who are supposedly going to be at the front lines are sheltered from all that. So it's tempting to think of that as, well, the patients at least don't get gouged because these charitable foundations are paying that. But what it really does is it's sort of insidious, because it maintains these super high price levels and essentially forces it into a general payment from taxpayers, if it's Medicare or Medicaid, or all the employers. And really, at the end of the day, for commercial insurance, all the employers means all the workers. It's part of workers' benefits. So no matter how you cut it, we are all actually paying for this. And these kind of tricks of the trade just keep the party going for certain people, while the rest of us are still paying. Sorry, I had to get on my soapbox, but it's one of those. Definitely one of those. All right. Number 8. This is our first COVID-related Shkreli Award, this year at least. And it's a great example of innovation in the money grubbing department. So a hospital that steers patients to the ER for COVID testing, inflating the bill as much as 30 times. So Lenox Hill Hospital in New York City directed patients to their ER just to get a COVID test. And then they charged them as much as $3,000, according to the New York Times. For reference, as many of us have learned over these years of the pandemic, a standard charge for a nasal swab would be maybe around $100. So while insurers, not patients, were on the hook for most of these bills, the prices hit us all. Here's another version of that same issue. Greg, what do you think? Comments?
Well, it's even more outrageous when you think about the availability of COVID testing around the world, in which you can get it for free through the mail. You can go online and order as many tests as you need to take it home. If it's a rapid test, perhaps you have to go somewhere for a PCR test. And so this is complete predatory behavior by Lenox Hill. And I think I might have said in the print version of the awards that we should reclassify these hospitals as predatory species, like cats, lions, tigers, and those other leopards. But then I thought it's too mean to the poor feline. So like these are just really sort of extortionists, because these tests do not cost that much to do. They don't cost that much to manufacture. And again, you could be many places around the world where this is just part of the healthcare that you get through your national health system.
Yeah,
Well,
and
part
in
of
fact,
public health, for God's sake,
right. In fact, but what do we expect? Do we expect to mail tests to people at their homes?
Oh, get real.
Will, what do you think?
Any thoughts on this one?
I mean, this is just.
You should just jump in, by the way.
I know, this is just awful. I mean, there's so many better ways to do it. I don't know. It's strange to me, the administration of this at this hospital, making testing happen this way. Then they have the heroes work here sign out there. The kind of the juxtaposition of that is kind of interesting.
Yeah, you kind of want to be on the in on those conversations where the marketing department says, "Hey, I know we could charge people $3,000 to get $100 test."
Right. Yeah.
Tell them to come to us if they want to get PCR tests. So number 7. This is another hospital-based one, ER-based one. A woman leaves the ER after waiting 7 hours without being seen, and the hospital charges $700. So Taylor Davis spent 7 hours with a head injury waiting in the ER of Emory Decatur Hospital, and she left without being seen by a doctor. So imagine her surprise at receiving a $700 bill from the hospital, according to Fox 5 in Atlanta. When she questioned the charge, a hospital representative told her, and I quote, "You get charged before you're seen, not for being seen." Any thoughts about this, Will?
There are so many ways, there's so many fees and so many charges that that hospitals and insurers, put onto patients. This is, I think, by far the dumbest one. This is an expensive waiting room chair that this lady was sitting in, and that's a first class seat on an airline, right? And maybe if Emory was offering beverage service or like a moist towelette, I don't know for sure. I assume these chairs didn't even recline. And so I don't, it's awful. And again, think about how often this goes unrecognized by people. They get the bill who actually they were seen, they get the bill to see a facility fee and don't question it. Yeah. And that's what hospitals are banking on, right? They're hoping that these just go overlooked and that they get paid either by insurance, or if insurance won't pay, put it on to the patient. And this was something that got into the news, but most of the time it probably doesn't. And I'm sure there are many other hospitals that are doing this exact thing.
Yeah, well, the facility fee angle is sort of something that has proliferated throughout American healthcare. And, a lot of doctors have also benefited by being acquired by practices, and then acquired by hospitals, and then they become a hospital's location, and then the facility fee is added on. So there's a lot of that.
Even though they don't become a part of the hospital, right? I mean, the procedure, are still being given in the doctor's office outside the hospital.
Oh, physically nothing changes, right?
Yeah.
It's still the same building. The sign changes, and then the facility fee is slapped on. So,
I mean, the sad thing is that it's completely not funny, right? It's a wealth transfer exercise, right?
Oh yeah.
From you to the hospitals, and all of the things we've heard so far are really taking from the poor and giving to the rich, and so it's baked into our system in a set of perverse incentives that you covered for 5 years in these awards, but it's no joking matter. So
everybody remembers Ross Perot, the guy who ran for president years ago. Actually, not everybody does, because if you're under the age of 30, you don't. But he used to say, "That giant sucking sound you hear is jobs leaving America and going to Mexico," because he was fighting against NAFTA at the time. Well, that giant sucking sound you hear now is the healthcare industry sucking all the money out of the rest of the economy. It's truly astonishing.
All right. The hits keep coming. Number 6, hospital claims Medicaid doesn't count as insurance, and then raids accident victims' insurance settlements. When someone gets into an accident and has to go to the hospital, they expect their insurance to cover at least some of the cost. But some hospitals have refused to bill patients' insurers, and instead they've placed liens on patients' settlements from accidents in which patients were awarded some monetary compensation or damages. That's all according to the New York Times. That practice allows them to charge a higher amount, sometimes tens of thousands of dollars more than what they could have or would have billed the insurer. In a legal brief filed by Parkview Regional Medical Center in Indiana, the hospital said they do not bill Medicaid because it's governmental assistance. It's not health insurance.
So I think that's probably news to all the Medicare and Medicaid beneficiaries out there, that Medicare and Medicaid are not their insurance, when in fact they are insurance. They just happen to be paid by the government. But it's an incredible trick, because hospitals get to charge people who are not insured higher prices for any given procedure because they don't have an insurer negotiating for them. So people who are uninsured ironically get charged more for anything, a visit to the ER, a hip surgery, whatever, than a person who has insurance. So by claiming that these patients don't have insurance, the hospital gets to charge full price. And they're doing it to people who, if you're on Medicaid, you're not wealthy. So you already really need that accident settlement to help pay you because you missed days of work, to help pay for childcare, whatever it is. The accident settlement is probably pretty important. And these hospitals are taking an incredible advantage of people who are least able to sustain that kind of behavior. Who thinks that's okay in the hospital?
Yeah.
Yeah, that's my question. Like, what is the scene? What is the thought process behind coming to that conclusion? And the series of events that have led to that. It just I don't understand. I can't understand it. I don't know. Greg, do you get it? I do. I mean, I don't know.
I don't know. I mean, a lot of these hospitals are, consolidating, being owned by larger financial firms. The goal here is not patient care. It's not about protecting your health and the public health and the social welfare of people who pass through your doors. It's enriching the payments out to shareholders and to people who run these giant corporations that have taken over most hospitals in most states. And so that's baked into our system in a way that, people who work in healthcare, like all of us on this call, never went into this business to become extortionists. And what we're hearing is a series of cases of extortion across these awards so far, all the way up to number 6.
Yep. We're going to ask you guys this question later in the program, but what is it going to take for the American public to just rise up and say, this is not okay and we don't want this system anymore?
Yeah.
I'm not sure what it's going to take. We're hoping that, awards like this help kind of pile on and get people's outrage going. But it's almost as if, people get inured to all the outrages and they just can't handle it anymore and don't feel like they can do anything about it, but they can.
I'm reminded, I'm trying to remember the book, Kevin Phillips, he was a strategist for Nixon. So I'm showing my age here, but he wrote a book, describing the history of financialization of the US economy. And it's certainly been something that was turbocharged after, 67 or 74, whenever you want to date it. But the financialization of multiple sectors of the economy. And it feels like we're sort of in the late stages of this entire process, this mega trend. And now we're financializing healthcare and healthcare itself, so that as Greg pointed out, my guess is that the mentality is really about the numbers. It's the spreadsheet. It's how do you make your numbers? How do you get your numbers? How do you justify your bond rating? How do you, all of that is in the mix here. And I think that's a huge driver. So at the end of the day, outrage is not going to fix it. Outrage may motivate us all, but what we got to do to fix it is to change, these trends, including the financialization trend, which means big changes in how we pay for healthcare, how we organize it, and how we regulate it. So.
Oh yeah, but we're the revolutionaries here.
All right.
All right, number 5. Hospital system files 19,000 lawsuits for unpaid medical bills, all while receiving $700 million in COVID bailout funds. So CNN reported that Community Health Systems, which is one of America's largest hospital chains, filed at least 19,000 lawsuits against patients for unpaid medical bills. And they did this during the pandemic. It was also during a time that the system achieved record profits, in part because they received $705 million in pandemic-related aid. Now, eventually the hospital kind of went back on this policy and stopped suing their poorest patients. But a hospital spokesperson said that many of the patients didn't fill out the paperwork that was necessary to qualify.
Yeah. So if you look at some of the quotes from this story. They tried to justify it by saying they withdrew lawsuits against people making less than 200% of the poverty threshold, which is about 54,000 for a family of 4. And so it was so nice of them to withdraw that, but a family making 55,000 was fine.
They could pay that.
And a 1-week ICU hospitalization, can easily cost $500,000 or more, and it doesn't matter, how much you make, in the middle class. You're not going to be able to pay that, even if insurance covers most of your hospitalization. Most of the time, with deductibles, with out-of-pocket maximums, you're still on the hook for 20,000-30,000 for something like that.
Look, how many of us can pay that? How many of us on this call can pay that easily?
Right.
No,
it's not easy at all. And I've been through this with medical bills personally as well. And I'm fortunate enough that I was able to pay them, but it's very easy for it to financially devastate people. And I don't even know what hospitals are thinking, to be honest. Like, what's the thought process about suing people for unpaid medical bills? Like, oh, this person can't pay their bill. Let me legally force them to pay a bill that they can't pay. I just don't, it just doesn't make sense to me.
Yeah, well, again, I keep coming back to the fact that, this is healthcare, this is illness, this is a difficult time in someone's life. It's not the same as, I bought my iPhone on credit and I'm not going to pay for it. It's not that at all. So I think until we sort of make that very clear and understood, we're going to have to, face these kinds of stories regularly. All right. Shall we move on? Okay. So number 4, a drug manufacturer prices a COVID-19 pill developed with federal funds 40 times its production cost. So Merck's pill molnupiravir was recently approved for emergency use to treat COVID-19 in the US, and many of us probably heard about it. And this was after it was shown to modestly reduce the risk of hospitalization or deaths. What's the catch? The Intercept reported that Merck charged the government $712 for a course of the drug. The cost of production of that course was $18. And that whole drug and the production of it was created using millions of dollars of government funding. Merck actually has granted a royalty-free license for use in low and middle income countries. I think that's more than Moderna has done for their vaccine, but they still stand to make $5 to $7 billion from the drug, funded in large part by taxpayers. So, Greg, what do we do about this?
Well, look, every time you show a single case, I can tell you 10 others. What's interesting is that there was a change in the treatment of hepatitis C a while back with directly acting antivirals, and PowerPoint appeared from Gilead Pharmaceuticals, trying to figure out what the price should be for the drug. But it wasn't about what the drug cost, it was what the system would pay for it. And so it was $86,000, I think, for the initial curative 12-week course of therapy. None of these drugs are priced at what they cost to do. They're not priced at what the R&D entailed, because they'll never open their books. They all say, like, we invest in not just the success drugs, but the failures in our research and development history, but they'll never tell you how much they paid in terms of research and development. I'm glad you mentioned Moderna, because Moderna basically got a lot of money from the federal government. The federal government, NIH researchers helped to develop the vaccine, and now Moderna is holding most of the rest of the world hostage and leaving them unvaccinated because they have refused to share their recipe for the mRNA vaccine, which many of us on this call, probably many of the people watching here, have taken. Again, you take and depend on government largesse, and then you screw the public, and not only in the United States, but globally around the world.
Well, and that one's partly on the previous administration that cut the deals with the vaccine manufacturers and failed to say, and oh, by the way, you're going to have to share your your technology with other vaccine manufacturers around the world to make sure that everybody else gets vaccinated. And the really awful part is the cruel irony is in the countries that aren't getting vaccinated, the variants are starting to pop up. And so now we get to share those.
Yeah, there's plenty of blame to go towards the Biden administration as well. They
haven't done much about it either.
I mean, this is a theme too. They rolled over and played dead for industry, and really are really worried just about their supply in the domestic market. So,
which is insane.
Yeah,
because the pandemic doesn't really care.
No, it makes me wonder. I just wonder how many of these problems can be helped with just making R&D, making the process fully transparent and costs and. Because a lot of, I mean, this recurring theme with drug costs and just being brought up out of the blue and with no rhyme or reason, it seems like. And so just providing a little bit more transparency throughout the process so that people know, what these things actually cost. Because I don't know. I don't think anybody, I mean, we don't know like really what the true costs are.
Mm-hmm.
Yeah, and other countries basically look at the effectiveness of drugs and the price and decide whether it's worth paying for it. Basically, you could put anything on the market in the United States, we're going to talk about it in a little while, and whether it works or not isn't the question. It's the question whether somebody will prescribe it, whether somebody will pay for it, and whether somebody will put it in their mouth.
Well, yeah, and Medicare, unfortunately, is proscribed by law from doing much negotiating at all, and certainly not on the basis of effectiveness. I mean, this Merck drug for COVID, they stopped the analysis of the drug in the middle of the trial, the clinical trial, and that said, wow, it works really well. And so they get it approved and they put it on the market. But now that they've analyzed the full data, it's not as effective as it looked to be before. And so they ought to be charging even less now. But the worst part about this drug, it seems, is that there's some worry that it's generating variants because it's sort of like taking only half of your antibiotics. It's not completely killing off the virus. It's kind of effective. And so it may actually be sort of helping variants appear in people's bodies who are particularly vulnerable, who have, underlying immune conditions or whatever it is.
Well, I got to say, it was a great business move to price it at that moment, right? Interim analysis.
Yeah,
looking great. Let's set a price now because, regression to the mean and all of that, we don't want to deal with what might happen. And that is what happened. So in a perverse way, that was smart business. Terrible medicine.
Yeah,
terrible medicine.
Absolutely. So onward to number 3. We're getting down to the count to the final one, the winner of all time. Okay, so in recent years, private equity has been investing more and more in healthcare, as everybody knows, and that's kind of old news. But if healthcare companies want to be really innovative, they can't just partner with private equity. They have to be private equity. And that's what our number 3 Shkreli winner did. Ascension, which is the nation's largest Catholic nonprofit health system, has created a $1 billion private equity system. It's almost like a firm, and it's invested in other healthcare providers and a debt collection company. That's according to Stat News. Ascension says that profits from its capital gains on its private equity helps them care for the poor and the vulnerable. Except that Ascension initiated cuts in services at 2 of their safety net hospitals, and one of those hospitals was closed and converted into an urgent care center, which is undoubtedly more profitable. And that was over the protests of local healthcare workers and community leaders. The picture that you see now that's up on the screen was taken during one of the protests, courtesy of National Nurses United.
So it's a little bit surprising, that a nonprofit Catholic healthcare system would, partner with investors and form their own PE fund like this. What's absolutely really not surprising to me is that would result in kind of rolling back some of the safety net, things that are in place that they've had as a nonprofit system. Because are we supposed to honestly think that anybody who partners with PE and investors would not let those people have a say in how things are run. I mean, that's as soon as you get into that world, and in ophthalmology, PE is, as in a lot of different specialties, PE firms are buying up practices, and the big downside to doctors who sell to those practices is that they have obviously less of a say in how things are run, and that's exactly what's going on here, and that should not be surprising to anybody. And so the idea that they're trying to say, well, we did this because so we can funnel more money into helping the public, that's nonsense.
Yep.
Yeah, well, just to clarify, this is a case in which they kind of turn the tables. It's not so much that, as is often the case, like with ophthalmologists and ER docs, that private equity stepped in to tell Ascension how to run their show by taking an investment or buying them out. This is a case where Ascension decided to partner to create, I think it was $1 billion private equity fund, to do that to somebody else, effectively, to essentially take private equity and start investing in various kind of activities, other healthcare providers and the like. And so you got to wonder what kind of investments, how they decided what investments to make, what were the criteria, what kind of profitability were they looking for, and therefore, to the extent they're investing in other healthcare providers, precisely that same point. What were they demanding after they made those investments in terms of the kind of care that would be delivered at what price, and et cetera. So it's very convoluted, but typical of where we are these days.
And there's no amount of Hail Marys or Our Fathers that's going to get them forgiven for this one. This is unforgivable. Straight to hell for this.
Oh, I call them the Sisters of No Mercy.
Did they get to maintain their nonprofit status? I'm guessing they did.
Yeah, it's an investment.
You basically have to kill the Pope to get to have your nonprofit status taken away by the IRS. It's pretty amazing.
I think when the word billion is thrown about in regard to your company, I think that should be an automatic disqualifier, right?
Or they should all be excommunicated.
Yes, but that's not going to happen. Oh my goodness.
All right. Well, here we are. We're down to the last three. That was number 3. Here's number 2. Family at the heart of opioid crisis offered immunity despite harm to millions and deaths to hundreds of thousands. Our Shkreli runner-up this year goes to the Sackler family, the owners of Purdue Pharma, who aggressively marketed OxyContin and fueled the opioid crisis. This is their 3rd time as a Shkreli Award winner, so this is a three-peat for them. A bankruptcy deal approved last September would have given the Sacklers immunity from future civil lawsuits, and they would not have had to admit any wrongdoing. NPR reported all this, and they said the deal would require them to give up about $4 billion out of their $11 billion fortune. Not even a drop in the bucket compared to the estimated costs to society of overdose in America, which is about $1 trillion a year. So there's one encouraging little update to this award. A few weeks ago, the bankruptcy deal was actually rejected by another federal judge. And as is their right, the Sacklers now plan to appeal that decision.
So this one really means a lot to me. My day job is working on overdose and substance use, and watching the sort of explosion of overdoses over the course of the past few years just breaks my heart. And what I think we need to talk about is collusion between the judiciary, our politicians, wealthy families and donors, and institutions like the hospitals and the drug companies we've talked about before. They have literally gotten away with murder. And because of who they are, because they're one of the richest families in the United States, there's hospital wings named after them, there are museum wings named after them, there's schools named after them. They have escaped judgment for this. And as you said, the costs that have been incurred by by American families, not just the money we're talking about, but just the pain and suffering that the opioid epidemic has sort of unleashed across the country in many places that have been vulnerable and downtrodden, like places in West Virginia where I've done work, in Southern Ohio and other places. Just the devastation that this family has caused and gets off scot-free, even if there's some changes in the judgment, it's just abominable.
So our friend Bill Adams in the chat, I can't help but repeat this. He says, let's name a prison wing after them.
I saw that. I like that idea. That's great.
Yeah, and you know, the thing is, what they did is illegal, but so much of what happens isn't illegal. It's the stuff that happens, you know, that's not outside the legal pale that is so appalling because it's so unethical and so antisocial. And I'm not exactly sure why people can't be prosecuted for things like murder in these kinds of cases. I mean, has that ever even been considered or ever done?
I have no idea.
No idea.
We'd need to have a legal panel for that conversation, I think.
Yeah.
Yeah.
All right.
I'm so glad they made it, though. I'm so glad they made it into the list.
How could they not?
As I'm sure everybody was just waiting with bated breath. Where are the Sacklers? They had to be here somewhere.
Yeah,
so,
if they were not here, they would have been robbed.
Where were they? Where were they the last 2 years in the list? Have they ever made number one?
I'm not sure they have, but you know,
I don't think so.
They're knocking on the door. So
Well,
better luck
maybe
next year, Sacklers.
Yes, better not. Good luck.
Give them some time.
right. Or maybe we should have a weighted average for the best of the last 5 years or 10 years. They would win hands
Yeah,
down.
you know, winners of all time, like Jeopardy.
Lifetime Achievement Award.
Crystal in
Lifetime
the chat.
Achievement
Lifetime Achievement
Award.
Award.
Crystal says in the
That's
chat.
right.
It's good.
That's right.
Oh, it's so awful. All you could do is laugh
Ugh.
and then
Correct.
get out and march in the streets. So, number one, I know you've been waiting for it. Here it comes. Numero uno, best in class, goes to the FDA for fast tracking an unproven drug, defying its own advisory committee, and putting millions of seniors at risk. So we're talking, of course, about Aduhelm, which is the Alzheimer's drug made by Biogen. Not one member of the FDA's own advisory committee supported the approval of Aduhelm. The agency's own statisticians said the company's data failed to show that the drug was effective, and yet FDA higher-ups gave it a green light, and Stat News found that the FDA was actually unusually proactive in supporting this drug. They even drafted a roadmap for Biogen to get it approved. They put it on something called a fast-track approval or accelerated approval, which meant that it got approved on the basis of much lower levels of evidence. So here's a drug that's been shown in 2 clinical trials that does not improve people's cognition, and yet it gets approved for exactly that. So
There's gotta be.
This is so, I mean, I'm still writing about this in various places because it's so incredible.
Yeah, there's going to be more information coming out about this. Like heads are going to roll over this. Or they should at least.
They should.
I keep thinking about the vaccine approval, and just comparison to this. Like we were all waiting for FDA approval for the vaccine. It feels like for so long. And then you look at something like this that was just pushed through. Hey, what was the scene like in the FDA? I don't get this. It's like you come to them and say, well, this has no evidence that it works. By the way, it does cause brain bleeds in 40% of patients. What do you think?
Yeah.
And it was like everybody was, who made that decision? Who was the person that overlooked the advisory committee, overlooked the evidence and said none of this makes sense. I keep saying that. This whole list is ridiculous. It's crazy that people are doing these things. But like I said, there's going to be more to this story. There has to be.
Yeah,
Well-
well, we actually know who the person was inside the FDA who
Oh,
championed
it's Billy Dunn,
Dunn,
Patricia Cavaradossi,
Oh.
and Janet Woodcock. Janet Woodcock says she
Yes.
says she stands by her decision. Nothing says that you made the right decision when your advisory committee resigns. The EU and Japan won't pay for it. The VA won't pay for it. Massachusetts
Right.
General Hospital, Mount Sinai, nobody will pay for this drug, right? And so, you know, Vika's talked about the Nixon administration. I don't know if you remember Patty Hearst. You know,
Oh, yeah.
she gets kidnapped and then she appears and she says, "Call me Tanya." She's all dressed up with the, you know, they have Stockholm syndrome at the FDA.
Stockholm syndrome.
You know, they are completely captured, and what
Yes.
industry wants, industry gets, right?
Yes.
You know, and this is the problem because it's not the first drug they've done this on.
Nope, it is not.
Exondys, you know, we can go through the list. And so there's rot at the FDA, there's regulatory capture at the FDA. And frankly, you know, President Biden has not been a big help on this. I think this is a bipartisan train wreck at the FDA in which the goal is to speed drugs through the market, no matter if they work or not, because that's the metric by which, you know, PDUFA and their funding comes through. They're no longer a public health agency. Again, they're a wealth transfer agency, and moving money around the market. In this case, from Biogen to the pockets of patients who are willing to pay out of pocket because nobody else will.
Yeah.
And this should really scare patients, but it also should scare doctors, because they're the ones who are writing the prescriptions. And I think that it's pretty clear that most doctors are really not aware of how bad things have gotten at the FDA, that, you know, that 6 cancer drugs would come up for review and the studies would show that they don't work and they stay on the market anyway.
No,
Because
this goes back.
I don't know why. They just stay on the market anyway. So then they get prescribed to patients and they are not side effect free. And doctors are not aware of this, patients are not aware of this. And it's kind of, you know, do you ever feel like you're the little kid who says the emperor has no clothes?
Well, you know, the other thing is we're talking about the charities, the Alzheimer's Foundation, whose CEO makes $1 million a year, by the way, and their top 5 executives make, the top 10 executives make in excess of $3 million a year, are all in on this, right? So there was an advance for patients, et cetera, et cetera, et cetera. So, you know, these groups that are supposed to be patient advocacy groups are on the take, you know, to put it mildly, and colluding in this. And the Aduhelm is just sort of the worst case scenario, but, you know, we really haven't figured out a way to stop things like this from happening.
Yeah.
Absolutely.
Well, in this case, I mean, I don't know if this is the straw that breaks the camel's back, but I got to say, you know, the drug originally was priced at $56,000 a year. Now they cut it to $28,000. Thank you, my God. But the real thing that's going on here, and many of you know about this, is that Medicare, CMS announced one of the, or maybe the largest price hike in its history, and they said half of it is attributable to this drug. So suddenly you've got all seniors who pay premiums for Medicare Part B paying for this. So that ought to scare the bejesus out of all of us, because really what that means now is we're all going to just be paying into a pool that ensures a return on investment for things that really barely, if at all, work, where the risks are super high. And, you know, there's so much we don't even know. So there's a lot to do. Now, the Biden administration, you know, the Secretary of HHS on Monday asked CMS to revisit this price hike. Now, they must already know what the coverage decision is going to be that's announced tomorrow, but I think they could do a lot better than just politely ask. I think there's more that could be done. And I think, you know, watching this and watching the drug price scene in general in the last few years, it's absolutely been a bipartisan Stonewall effort, despite the rhetoric. Trump campaigned on drug price control. Obama campaigned on it. A bunch of people in the Biden administration are on record in favor of drug price control. Where is it? Where's the beef? Haven't seen it. So,
Well, and what it really boils down to is that Congress is a wholly owned subsidiary of the pharmaceutical industry. It depends on pharma money for campaigns, along with money from all kinds of other industries. And so this is really the root of the problem. And Congress is the boss of the FDA. And so I have a certain amount of sympathy for people at the FDA who really are government servants for the most part. They are not going in so that they can make a big buck. And there's no greasing of palms that's going on that you can see, but there's this process where their thinking has been completely distorted about who they're supposed to serve, in part because 80% of their money comes from the pharmaceutical industry directly through the User Fee Act.
yeah. I mean, the original idea, of this law called PDUFA was, let's speed up drug processing at the FDA, but rather than have the budget increase land on taxpayers' doorstep, let's charge the companies that are going to get the approval. And at the time, in the 90s, I'm sure that was kind of made a lot of sense to people. It was kind of this era of market fundamentalism, on steroids. And so at the time it might have made sense, but over the years, what's happened is many in the FDA now see the pharma sector as their kind of customers. And this is kind of the result that we see, sadly.
Well, it was also the AIDS movement, wasn't it, Greg? That, that people were dying and the FDA was taking a long time to say yay or nay on the drugs.
Well, we don't want to go down that road, but we opened a Pandora's box, and yes, maybe the FDA was sclerotic in the 70s and early 80s, but everything is faster now, and it's not about the quality of the data or whether a drug even works. No. And so it makes me crazy when people say, the FDA is killing us. Well, we did that in 1989, 1990 until we learned our lesson and realized, somebody's making a killing and it's not the FDA.
Yeah, absolutely. Well, now we're going to ask you the really hard question, guys. What do we do? If you can name one thing to make this the last Shkreli Award in terms of, going after greed in the healthcare system, what would it be? And I know that's a ridiculous question, but I'm going to ask it anyway. So Will, any thoughts?
Yeah, I think the only way to get rid of the Shkreli Awards is to rename it the FDA Awards.
No.
I think that's the only way, is just to give it a different name, because there's, as long as our healthcare is tied to profit, this is going to keep happening. Maybe I'm just being pessimistic, but it's I am being pessimistic, but it's when people can make money off of the healthcare of individual people, we will always have graft and greed, and we got to have a different system.
Yeah. Greg, any thoughts? Anything that you like? What could President Biden do tomorrow that would start us down a better path?
Well, he should grow a spine, right? Because this is about breaking private power.
No, you can't be the fairy godmother.
No, but the point is about breaking private power. It's like the fact that private equity, these large corporations run our hospitals, that drug companies can sort of get away with murder at the FDA in drug pricing and in colluding with charitable organizations like the Alzheimer's Association. It should be illegal, and the people who can make that happen are politicians up and down the line. But as you were saying, Shannon, they're the biggest lobby in DC. But we've got to. This is a political problem that we need to solve politically, and it means not saying it's the Democrats or the Republicans, because they're all on the take. Kathleen Rice, who's the representative from my hometown on Long Island, outside of New York, tried to, was successful in killing some of the drug pricing legislation amendments in the COVID bills and the Build Back Better bill. What is she doing? She has a constituency of seniors and people who are dying because of expensive drugs. And she realized her meal ticket is not home with her constituents; it's with the industry she serves.
Yep. Well, Philip Rowland Seymour in the chat says campaign finance reform, perhaps the one place where trickle down can work. And he may be right. There's certainly something to that. Well, this has been really interesting. Thank you so much, guys. We have a couple of things we want to go over before we wrap up. One is we want to tell the audience and a little bit about a new awards program that's pretty much the opposite of the Shkreli's. Our founder, who is the pioneering cardiologist and humanitarian, Dr. Bernard Lown, died last year. And in his honor, we've created the Bernard Lown Award for Social Responsibility. So starting this year, we'll give this award to a young clinician who displays bold leadership both inside and outside the clinic, someone who makes an impact on health, the environment, or other social justice efforts. So nominations for candidates for the award are open until March, and you can learn more about the award and nominate someone on lowninstitute.org/award.
All right. That's our countdown. Thank you all for joining us. And a special thank you to Will and Gregg for being our guest panelists today. Will is an ophthalmologist and comedian. You can find him on Twitter and TikTok. Gregg is an epidemiologist and global health activist. You can find him on Twitter as well. So thank you as well to our full judging panel who are listed on the Shkreli Awards site at our website for being part of the Shkreli's this year. And we could not do any of this without the unbelievably good reporting that revealed these stories. So please go to lowninstitute.org to see the full descriptions of the winners, read the comments from our judges panel, and take a look at the great work from the journalists who first reported these stories. For more news and blogs throughout the year, be sure you're subscribed to our newsletter, Lown Weekly, and you can do that at lowninstitute.org/subscribe. So have a great rest of the day, everybody. We'll see you next time.